and welcome to part 2 of our lower body nerve glides. These nerve glides do require a little bit more motor control and balance. So if you need to, you can grab something to hold on to so you're more stable. And then you also will need a chair, preferably a padded chair. So I have this metal chair and I just placed a throw pillow on top. You just want it to be comfortable for your knee. So these lower body nerve glides are going to focus on the femoral nerve and the obturator nerve. So that's the nerve that runs through your quad and then your adductors on the inside of your leg. So to start, we'll work the femoral nerve first. This is going to help if you have any knee pain or if you have chronic tightness in your quads, your psoas, any of these muscles and nerves, tendons around your leg. To start, you'll come to the side of your chair and then carefully, like I said, if you need to, please grab onto something. You're going to take your knee on top. You might have to adjust a little bit and you want your foot on bent, so your leg bent, so your foot is on top resting. You want basically a neutral stance, so if you were standing, your feet would be roughly hip width apart. Grab onto whatever you need to. To start, I want you to sit up tall. So this is going to be a really sequential movement. We're going to go step by step. I want you to make sure that if you feel any tension, that might be where you stop today, and that's totally fine. It's going to be different for everybody's mobility, range of motion, and if you've done nerve glides before. So we have our knee down on our padded surface. We're sitting up tall. From here, you're going to do a posterior pelvic tilt. So all that is drawing the hips up to your rib cage, tucking your hips under. Okay, so we do that here. We're still standing up tall. The next step, imagine someone takes a bar right to your navel, and you're going to slump over top of that bar, drawing your chin to your chest. Next step is to rotate through the core to the away from the knee, and then you're going to side bend away from the knee. Now you're going to feel probably a more intense stretch, but you may feel a little bit of that nerve engagement or mobilization of the femoral nerve. Now to glide here, you can mess around with the pelvic tilt, or you can just kind of side bend away. This stretch may feel good enough, and that's totally fine. All right, when you're done with that, carefully step out of it, and then we'll do the same exact thing for the opposite side. Taking your time, find your balance, drawing your knee carefully onto your bench or your chair. Once again, stopping where you feel that area of tension. About a 3 out of 10, if 10 is like max tension, 3 is kind of where you want to be stopping. Find that neutral stance, posterior pelvic tilt, bar comes in, we slump over the bar, holding everything else we have, rotate away from the knee, and then side bend away. You may need to drive your body forward a little more, and then you can mess around once again with the pelvic tilt, feeling the femoral nerve right around your hip flexor area. It may just be a more deep, intense stretch of the quad, and that's totally fine. Once you feel even, carefully come out of that. All right, shake it out. So we have one more, which is the obturator nerve. So this is the nerve that works our adductors, the inside of the leg. So same thing again, taking the knee up carefully. Now, make sure you have your balance. The obturator is the inside, so we have to walk that foot away quite a bit and then come into kind of a lunge on that left side. Sit up tall, posterior pelvic tilt, drive the body forward. You're gonna feel it already on the inside of the thigh. Bar comes in, slump over the bar, rotate away, side bend away. So I'm feeling this right away. Once again, mess around with the pelvic tilt, or you can side bend away. Carefully come back up, and then we'll do the other side. Nice job here. Taking as much time as you need. These are difficult positions to get into. It's important that you don't rush. Take your time. Carefully setting up, sitting up tall, and then when you're ready, lock the foot out, bending the knee, sit up tall, posterior pelvic tilt. Drive the body forward. Bar comes in, slouch over the bar. Rotate away from the knee, and then side bend away. You want to feel this on the inside of your leg. Once again, you can pelvic tilt forward, side bend. When you're done, you feel even, carefully come on up and step out of it. awesome job today. If you have any questions, please let me know. These are a little more difficult to get into, so hopefully you find some relief from knee pain and a better increased range of motion. Thank you.